tobacco is not just a health decision. It could be a pathway out of poverty for millions of families. An analysis has estimated that quitting tobacco could help nearly 11.5% or about 20.5 million households in India move up one economic class, with rural areas and the poorest households likely to witness the greatest impact. The findings were published in British medical journal Global Health. The study also suggested that nearly 7 million middle-class families could benefit economically by quitting tobacco. Researchers, including those from the Tata Institute of Social Sciences in Mumbai and the National Institute of Cancer Prevention and Research in Noida, said the findings highlight the economic advantages of avoiding tobacco. The research team further noted that the treatment of tobacco-related diseases leads to global losses of more than $1 trillion every year. They also pointed out that around 80% of tobacco users live in low and middle-class countries, where a significant share of household income is spent on tobacco products. The analysis examined data from more than 261,000 households using the National Sample Survey in the year 2022-23 Household Consumption Expenditure Survey to estimate the economic benefits of quitting tobacco and determine how many families could be lifted out of poverty. The findings also revealed that the poorest households allocate the highest share of their monthly expenditure to tobacco at 6.4%, while rural households spend about 6.6% of their monthly income on tobacco products. Researchers concluded that reducing tobacco consumption could significantly improve household finances and help millions of families move towards better economic stability. Reducing tobacco use is not just a health priority. It is an economic opportunity for millions of families. Healthier choices today can shape a stronger tomorrow. Stay tuned to Daily Salar Digital.